Hi, it's Christina with the Sisyphean Journal. Today's July 15th, and we are looking at the death that even 60 minutes took time to notice. 34-year-old Deborah Gray went to Hillview Women's Medical Center for an abortion on July 8th of 1989. She went through their counseling procedure and underwent some lab work. She returned on July 12th for the actual procedure. An ultrasound was performed and she was estimated to be 16.5 weeks pregnant. She signed an informed consent form for the abortion and anesthesia. The records don't show who initiated IV Brevitol for the anesthesia, nor do they document the dosage or concentration, nor Deborah's weight or the amount of fluid given. There's no record of a physical exam or any kind of exam to assess if Deborah was appropriate for this type of anesthesia. The doctor, Gideon Kioko, indicated that the nurse and other staff expected the drug to induce twilight sleep rather than general anesthesia. There was no anesthesiologist on duty and no physician overseeing the administration of anesthesia medication. So somebody else prepped her. Kioko initiated the abortion. There was no documentation of the effects of the medication nor of Deborah's vital signs. A hospital note indicated that Deborah had responded rather rapidly to the anesthesia, and that 3 minutes after Kioko started the abortion, her blood was noted to be very dark and she was having trouble breathing. Kioko spent 5 minutes completing the abortion rather than addressing the fact that his patient was clearly lacking oxygen. After 15 minutes of attempting CPR and advanced cardiac life support, Deborah was transported by an ambulance to the hospital. When paramedics arrived to transport her, they estimated that Deborah's brain had been deprived of oxygen for 12 minutes. She had a racing heart, went into ventricular fibrillation, was resuscitated but never regained consciousness, and she was pronounced dead on July 15th. Now, the autopsy found traces of heroin in Deborah's bloodstream. There was no evidence that the facility had screened Deborah for possible drug use, and again, if somebody had been properly monitoring her, they would have noticed that she was having trouble breathing, heroin or no heroin in her system. Kioko made the following excuses to the medical board after both this abortion and the abortion that ultimately killed Suzanne Logan, and I will link below to Suzanne's story. These are Kyoko's words. In the first two cases where Brevitol was given, I did not give it, nor did I consent to it. I was not consulted or asked about it. I did not even start intravenous fluids. The decision to administer Brevitol was made by the patient and the clinic. During those times, I would be called in. I would be notified, the patient is now asleep, doctor. You may start the procedure. Well, wait a minute. I thought woman and her doctor. I thought Deborah was supposed to go to the clinic and have a conversation with the doctor about the risks and benefits and, make this. Never mind that. ESP? I don't know. I therefore had nothing to do with the Brevitol administered to these two patients. Other contract physicians were also working under similar terms like me. They had nothing to do with the administration of Brevitol. I suppose I was just unlucky at the time and happened to be there when this incident happened. I would say that Deborah and Suzanne were the truly unlucky ones. So, regarding Deborah Gray, I understand that the Brevitol was given by Dr. Barbara Lofton, clinical practitioner. Barbara Lofton owned the clinic. She wasn't a doctor, but she walked around in a white coat with a stethoscope around her neck, introducing herself to people as Dr. Lofton. My initial contact with the patient was the initial sizing evaluation and to determine the gestational age of the pregnancy. There wasn't any evidence that he actually examined them. The next contact by me was when the patient was already asleep. As I was finishing the procedure, I called the attention to the administrators of the anesthesia that the patient's blood was getting unusually dark. So nobody was monitoring her oxygen sats. He's just noticing that she's leaking black blood instead of red blood. At that time, in my view, adequate resuscitation efforts was immediately instituted with airway established and 911 was called. EKG and oxygen were available and were used. Dr. Taylor, a cardiology fellow, headed the resuscitation effort. It was not true that adequate resuscitation was not done and equipment was not available. Incidentally, this patient had recently used opiates, though the patient had denied this in her medical history. And then he said that the case with Suzanne was similar somebody else knocked her out, and then she came in. The medical board noted that Kioko, as the physician performing the procedure, was still responsible for ensuring that the patient was being provided with appropriate care, regardless of how the clinic chose to assign the tasks. He was responsible for examining his patients prior to surgery, which he did not. If he did it, he didn't document it. And the board again noted that nobody was monitoring either woman's vital signs while Kioko was operating on them. So the board noted that in the above cases, Kioko performed surgical procedures under conditions that failed to meet appropriate standards for the delivery of quality medical and surgical care. In the event that Kioko was unable to correct those conditions, excuse me, the appropriate standard of care required that he not perform those procedures at this facility until the conditions were so corrected. Okay? Not my fault. The board also noted that Kioko demonstrated a serious lack of judgment. Kioko assumed that his role was limited to performing technical procedures upon anesthetized patients, leaving overall management of the patients to others. Dr. Kyoko's gullibility in this regard proved fatal. Now, while the investigation was going on, Kioko left Hillview and was hired by Sigma Health Center, another abortion clinic in Kensington, Maryland. In November 1990, they made this clown medical director, and he kept that post until he surrendered his medical license in order to get the medical board off his back. And I include a link below to a post I wrote about Kioko, because let me tell you, aside from killing Suzanne and Deborah, he screwed up a lot of abortions. Sorry for the motorcycle going by outside. Deborah's sister, who had known that her sister was going to Hillview that day and planning on meeting her for dinner that night, told 60 Minutes, "It's sad to think that people can go in and have a safe procedure, what they think is safe, and die. This outcome was just like a back alley abortion." And as I said, I'm providing a link to my video about Suzanne Logan. The National Abortion Federation, 60 Minutes talked to them. They knew how bad this clinic was, and they were hoping nobody would notice. They didn't want anybody to notice, because if you regulate it too closely, you deny women choices when it comes to abortion care. I would think that the choice to survive the abortion would be a very important one. Apparently, the National Abortion Federation and I do not see eye to eye on that issue.